Somebody once said that the most important piece of equipment in any doctor's office is the telephone. And while that may be an exaggeration, it's not a big one. So today's topic on steps to success in medical assisting will be the telephone. I'm Brian Browning, and like many of you, I'm getting ready for my certification test. I've learned that how you answer the phone conveys a strong message, rightly or wrongly, about the quality of medical practice. It's a job that usually falls to the medical assistant. Let's take a look at two scenarios. Then you can decide which medical assistant you'd rather talk to if you were the patient.
And a good morning to you, too.
Yeah, what's good about it?
Is something actually wrong, or did you just get out of the wrong side of the bed?
Oh, my kids are just driving me nuts. Taylor forgot to tell me he needed money for a school trip, so I had to tell him I didn't have any cash. Payday's not till Friday. Then I left the little one screaming in daycare.
I could lend you some money if you want.
No, he can just miss the trip. It'll teach him a lesson. Doctor's office.
Is this Dr. Slade's office?
Yes, what do you want?
Well, I'd like to talk to the doctor. My little girl woke up this morning and she's all yellow.
What about the whites of her eyes?
No, they're not yellow.
Well, how old is this kid?
She's a baby. She's only 4 months old.
So what have you been feeding her?
Well, she really likes carrots and squash, so that's all she's had the past few days.
Well, there's your problem. Cut back on the yellow vegetables.
You know, could I just talk to the doctor? The doctor knows Sarah.
I don't think he's in yet. Is he in, Jackie?
He's at the hospital this morning.
He's not in this morning. If you want to talk to him, call back this afternoon. Goodbye.
Rita was having a bad morning and she took it out on a patient's mother. Let's take a look at how the problem is handled by a more professional medical assistant, Annie.
Good morning, Jackie.
Good morning.
How's the day looking? I hope it's better than my morning.
What's the matter?
Well, my kids were giving me a hard time this morning. Jonathan forgot to tell me that he needed $20 for a school trip, and I had to tell him that I didn't have the cash. And I left the little one screaming at daycare because she's just too little to understand that I need to get here on time. And she wanted to stop at her favorite fast food joint for another breakfast.
Well, I could lend you some money if you want, and you can run down to school at noon.
Jackie, thanks. I don't want to impose, but it would resolve this little emergency. Riverside Medical Practice, how can I help you?
Did you notice her smile as she picked up the phone? That's a good tip. If you smile, the patients will hear it and feel more comfortable.
Well, I'd like to talk to Dr. Slade. My little girl woke up this morning and she's all yellow.
Okay, so let's start at the beginning. What's your name and your child's name?
Oh, I'm sorry. I'm Jane Johnson, and my baby is Sarah. She's only 4 months old.
Yes, I remember Sarah. It's Annie, Mrs. Johnson. Now tell me, are the whites of her eyes yellow too?
No, they look fine.
Well, that's a sign that it may not be anything serious, but what have you been feeding her?
Well, she really likes carrots and squash, so that's all she's had the past few days.
Carrots and squash are good, but sometimes too much of a good thing can turn you yellow. But just to make sure it's nothing serious, let's try to get you in here this afternoon. Let's see, can you make it in at 2?
Yes, we'll be there.
Wonderful. Okay, I'll see you then.
Bye, thank you.
In this scenario, Mrs. Johnson is relieved rather than more stressed, and her child will get a needed checkup, even though there may be nothing seriously wrong. In the first scenario, two things could have happened, neither of them good for Rita's professional career. Mrs. Johnson could have complained directly to Dr. Slade about the way she was treated, or she could have decided to find a new medical group with a more pleasant staff. When you answer the telephone, you are projecting an image of an entire medical practice. It's part of your job to make sure it's a good one, no matter what kind of day you're having.